Hello, everyone. My name is Dr. Sonal Chandratre. I'm a pediatric endocrinologist practicing in the United States, and I'm also a physician leader and national speaker, and I continue to bring in education and awareness about important healthcare topics, especially among children. And so today I'm going to talk about cannabis in its edible form, its ingestion in children, and its harmful effects. So recently, just this week in January of 2023, there's a new study published in the Journal of Pediatrics from the American Academy of Pediatrics describing the trends in pediatric cannabis edible ingestions in children younger than age 6 years. And what that study found out was that there was a huge spike in cases of cannabis ingestion in children, especially under the age of 6 years, from 2017 to 2021. And that is up more than 1,300% in that time. So to give you more statistics, in 2017, there were 207 reported cases. And now in 2021, there were about 3,054 cases reported, which, like I said, was an increase in over 1,300%. More than half of the children that were reported in this study were toddlers between ages 2 and 3 years. And more than 90% of those children got these edible cannabis products at home. Of the more than 7,000 cases of children exposed to edible cannabis products reported to the National Poison Data System between that time period, which is 2017 to 21, the researchers found out that 573 kids were admitted to critical care units. Over 1,000 kids were admitted to non-critical care units. About 2,500 kids were seen in emergency rooms for that reason. 625 cases refused care and actually did not go to the hospital. And about 2,268 outcome was unknown and there was no follow-up. So now some of the important things that we need to discuss is what are the effects of children that young if they accidentally consume an edible. So it's important for us to understand that edible cannabis contains a concentrated version of cannabis, and that can be extremely harmful for children. There are short-term as well as long-term effects of exposure to cannabis in children because children have younger brains that are still changing and still developing. And then during such a period where the brain is still developing, if there is an exposure to cannabis, then that can lead to problems with nerve connections, that can lead to negative impact on memory and IQ, and also lead to a higher risk of substance misuse and substance abuse later in life. Now, looking at the more short-term effects of what would happen if your child were to ingest cannabis, and then what would happen? Well, those symptoms really differ based on your child's age, height, weight, and obviously the amount of cannabis ingested. So this is really similar to any other medication that would affect children differently based on their size. Now, what kind of behavior changes would you see in such a situation? So some of the things that would really tip you off that your child may or may not, or may have consumed cannabis, is your child can present with slowed breathing. So any kind of breathing difficulty. Your child can be sleepy, drowsy, or even unconscious. Some of them can even go into coma, which is the severe form. Some of the other symptoms would be palpitations or even slowed heart rate. The child can have vomiting, agitation, confusion, and just a poor muscle control in general. Can also have seizures. So it's really important to understand that it can be a varied form of symptoms. And if you notice that your child has had this edible product right in front of your eyes, you may not find any symptoms right away. And that is because if you inhale the cannabis, or in terms of smoking cannabis, those symptoms appear in about 3 to 4 minutes. But if you are having an edible form and you ingest it, then that takes about good 30 to 40 minutes and even sometimes 3 to 4 hours for the symptoms to manifest. And that is why it's important to have an action plan of what you should be doing next. So then comes the next important question. what can you do as a parent if your child has accidentally consumed an edible cannabis product? So the first thing you need to understand is get help immediately. If you see that your child is having symptoms that I have described before, such as slowed breathing, unconsciousness, seizures, and you just think that your child does not appear right, is not talking to you, not interacting to you, then call 911 immediately. And if you are seeing this video in any other part of the world, then anything that is an emergency service for your country, then call that particular number right away. Now, if your child is still interacting with you, understand that your child still needs help. Just because your child does not have any symptom right now does not mean that your child will not need help, because, like I said, symptoms can appear later. So what you need to then do is call the poison control center hotline right away. Your child does need immediate help. So even if, like I said, they're not showing symptoms, and what would happen when you call the poison control is there are trained representatives that would guide you through the process and appropriately direct you to getting appropriate care for your child. And so typically what would happen is, depending on the dose, you would either be sent to the emergency room or your nearest urgent care or nearest hospital to seek medical help. At that time, you should ensure that you collect the remainder of this product and you get information out, look at the packaging, look at how much is there still available in the packet, what was supposed to be in the packet, so that you can understand possibly how much of this product your child may have ingested. Because like I said, the dose would really will be vital in giving you a direction for your child and for healthcare workers to act accordingly. For example, if your child has had about 20 candies, then obviously you have to seek medical help right away. But if you've had one candy, then at least you can wait to talk and understand what needs to happen next. So I just gave you an example, but always remember, no amount of candy can dictate what kind of symptoms your child might have. So you have to really look at your child and see what the symptoms are. And like I said, seeking medical help is of utmost importance at that time. Now let's talk about prevention. If you do have cannabis products, and understand that you might have cannabis products at home because you need them medically or for recreational purposes. In either of the situations, you need to understand that the best way to keep cannabis products away is to store them safely. And the best way to store them safely is to consider these cannabis edible products as any other prescription medications. So what do? We always keep them in a locked cabinet or any other area where children cannot have easy access to these products. Make sure that the container that you save this in is childproof. If they come in packaging that makes them look like a candy or some sort of a snack, then make sure that you're repackaging them in medicine bottles or similar containers. And I want to make sure that you understand the reason why I'm saying this is because if you look at the market, if you look at the availability of these edible products, they're really marketed in a very attractive way, attractive for children. So they come in as chocolates, gummy bears, other form of gummies, candies, lollipops, biscuits, cookies, or any other baked products. And they're also marketed in a very attractive way. So it's really difficult for toddlers to stay away from that because it really looks very similar to any other treat that they would typically have. And the worst thing is, even if you know that this is a candy and you're taking it as a medicine for medicational purposes, and you know that you should be taking only one, but since these candies or these products are made attractive, children don't know where to stop. And that's why they're more likely to consume higher doses of this particular edible form of cannabis. So make sure that you follow all these things. Other things you need to know is make sure that you do not consume these edible products in front of your children, because when they see it, they would want to have one. And even if they don't ask you at the time, they're very smart. They remember that. And anytime your eyes are not on them or on these products, and if they're lying around in the house, the inquisitiveness would really kind of stimulate children to go and kind of try them out depending on the age. If you think that your children are visiting relatives or friends, then and if you think that there's likelihood that this could be a problem, then always ask your relatives and family members and friends if they have any marijuana or cannabis products at home, and if so, how do they store them. As I mentioned to you, since it's legalized and is available more than 30 different states in the United States and maybe available in your countries as well where you're watching from, it's important for you to have these discussions with your friends and relatives. Now, if you think that your child is old enough to understand conversations, then make sure you have these vital conversations with children. It's really important for all of us to educate children about consumption of edible cannabis, either intentionally or accidentally. So in terms of accidental ingestion, make sure that you advise them that your children should be taking any food or drinks or any other products from people that they really trust. And if they see anything lying around, either in somebody else's house or even in your house, to ask before you eat or drink something if they just find it over there. Now, this is more in terms of age group 5 and above, but 5 and under, it's difficult to have these conversations, right? So you have to do all of these things to keep them safe. But when they are of that age to have those conversations, make sure you do have those conversations with children and keep them safe. So I really hope that you've got information out of this video and you know how to keep these edible cannabis products away from your children, and you've understood what to do if you see your child taking it, or if you have not witnessed it but you start seeing the symptoms, what are those symptoms, and then what you need to do in those circumstances. And so I hope that you have found this video helpful. Please like and subscribe if you like this, and please share it with your friends and family because this is such an important topic. And don't forget to tune in for yet another video on healthcare. Thank you for watching.